Hi, I'm Dr. Michael Walsh. Today we're going to change gears a little bit. We've been talking a lot about the spinal column, and in one of our previous videos, we described the intervertebral disc as a grape. Today we're going to talk about a different fruit, a cherry, as a way of describing pituitary tumors. Let's have a look.
The normal pituitary gland sits underneath the brain, kind of like a cherry on a stem. It also sits right below the nerves that convey visual information from the eyeballs to the rest of the brain. This is an important relationship we'll get into later. One of the ways we can look at the normal pituitary gland is with an MRI. When I'm reviewing an MRI with a patient, I often like to start with the sagittal or side view, which is as though we're looking at the brain from the side. Here you can see the pituitary gland sitting under those optic nerves we just talked about. In its normal state, the pituitary gland is like the master hormone regulator for the rest of the body. It's involved in such activities as growth and development, release of stress hormones, and is also involved in things like pregnancy and breastfeeding. However, sometimes some of these pituitary cells can start growing out of control, forming what's called a pituitary tumor. These are almost always benign, but can cause problems by such activities as oversecreting pituitary hormones, compressing the normal gland, or by compressing those optic nerves we talked about, which can lead to loss of vision. Here you can see an example of a pituitary tumor on another MRI view I like to look at, called the coronal or front view. Believe it or not, pituitary tumors are actually very common. They can occur in as many as 1 in 4 people by some studies. That means there's a good chance you know several people who have pituitary tumors who will live their entire lives without knowing that they have them or having any problems from them whatsoever. This just speaks to how benign these usually are. This means that frequently we just keep an eye on them by performing MRIs every so often. Some of the reasons we might decide to treat a pituitary tumor are if it's either continuing to grow while we are watching it, or if it's oversecreting a hormone which is causing problems, or if it's growing up into those optic nerves and causing visual loss. Although sometimes pituitary tumors can actually be treated with medications, a lot of times they will require surgery. This is usually done through an approach by going through the nose and the nasal sinuses. This gives us good access to those pituitary tumors, and a lot of times they can be completely removed. Hopefully, this serves as a good starting point for a conversation with your surgeon if you've been diagnosed with a pituitary tumor. I hope you've enjoyed this video. If so, please leave a like or any comments about other videos you'd like to see. Also, I hope you subscribe to this channel. Stay tuned for more videos in the future. As always, I'm Dr. Michael Walsh. See you next time.